This is John Boockvar. You're listening to Interview with the Surgeon with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. John Boockvar, Vice Chair of Neurosurgery at Lenox Hospital and Director of the Brain Tumor Center and the Pituitary Neuroendocrine Center of the Department of Neurosurgery at the New York Head and Neck Institute at Lenox Hill and Manhattan Eye, Ear, and Throat Hospitals. Dr. Boockvar is internationally known for his surgical expertise and for providing patients with safe, effective, and minimally invasive treatment for brain tumors, skull-based disorders, and disorders of the spine. Dr. Boockvar's surgical expertise is in brain tumors, skull-based endoscopic pituitary surgery, spinal and peripheral nerve tumors, minimally invasive spinal surgery, and complex spinal disorders. Dr. Boockvar has been recognized for his novel research in brain tumors and stem cell biology. He's been repeatedly named to the list of New York Magazine's top docs, best doctors in New York, Castle Connolly, New York Super Doctors, America's Top Surgeons, America's Best Doctors, and America's Best Doctors for Cancer. In 2016, Dr. Boockvar was elected to the prestigious Academy of Neurological Surgeons. In 2017, he was elected to the Senior Society of the American Board of Neurological Surgery. Dr. Boockvar has been featured on special episodes of The Dr. Oz Show, on brain tumors and medical mysteries, Good Morning America, and The Today Show with Megyn Kelly. Dr. Boockvar is also honorary surgeon of the NYPD and the New York State Troopers. Hello, everyone. Thank you for joining in to Interview with the Surgeon. Today we have Dr. John Boockvar. Dr. Boockvar, how are you doing today?
Very good, thank you.
So let's just jump right into this. What were your goals and aspirations during your residency, and how did those change during your fellowship?
Well, my goals during my residency, which I did at Penn in Philadelphia, were always very laser focused on getting the academic productivity and results out of my residency, both in surgical training and in the lab and research, to make sure I can secure the best academic job when I was done. I did not do a true fellowship after my residency, meaning a dedicated year after my training. I did what's called an infolded fellowship during the residency. But the goals were always very clear to me. I was very academic focused. I was hoping to publish 10 papers a year, secure grant funding, and become the best surgeon possible by doing every possible case I could do. And if I couldn't get into the surgery case, I was in the cadaver lab dissecting the human brain or the skull base to get that muscle memory developed.
So kind of take us through during that fellowship, or what was the mentality heading into your first job search, and how did that perspective change during the beginning years of your career?
Again, the perspective and the goal that I wanted with my first job search was, where could I go to continue the pursuits toward curing human disease? I felt that in private practice, I didn't want to run a small business. I wanted to actually impact human disease on a more grander scale. And I felt that academic medicine was a better way to do that. And so even with my job search, I wasn't interested in joining a private practice. I was more interested in joining an academic setting where I can do the four things that I think make up an academic surgeon, which is clinical excellence, research excellence, education excellence, and innovation excellence. And those have always been my pillars for which I've always formed my goals and aspirations around.
I think that's important to kind of segue to, the keys to your success. Take us through the mindset from the early years to where you are now. Was there anything that really stuck out to you that really helped you propel your career to get to where you are?
I think, if you're looking to be, particularly if you're looking to be in a big city, right, as a junior faculty, the chair of neurosurgery at Cornell, when he offered me the job, his quote was, "You could be Jesus Christ and no one's going to know you in New York City for at least 10 years. So, you have to find a way to separate yourselves. And really, the other piece of advice I would give is the advice that was given to me by Fadi Charbel, the University of Illinois, who basically said, the only horse you should ride out of your residency is your research horse, because all the other horses who are surgically trained are all alike. You can clip 100 aneurysms or do 100 knee replacements or 100 valve repairs, and there's going to be a person next to you who can do the same thing. But if you're running a novel gene therapy trial for aortic stenosis, that's going to put you in a different league, and that's how patients are going to come to you, particularly in the most competitive markets.
Sure. And just can you go back from when you started off to get to where you are now, the different jobs that you had and how each of those helped you continue to climb the ladder to get to where you are?
So after my training at Penn, I came right to Cornell, where I spent the first 10 years of my career. And I would say that the first 5 years of any surgeon's career is really getting the breadth of surgical exposure, because you have to learn how to operate by yourself, right? You have to learn how to get over the hump of every surgery. And every surgery has a hump. And so the first 5 years are just getting your feet wet and making sure you understand the stresses of, kind of being under the lights. While you're doing that is to develop your research arm and actually to make sure you get board certified. Because if you delay getting board certified, you just become a sitting duck for litigation. People love to sue surgeons who are not board certified. So get your board certification as soon as you can. The second 5 years, when you have that surgical sort of comfort level, is really when you should be looking to differentiate yourself. And I did that with some of my clinical research. So by 2004, when I finished my residency, by 2009, I had my first human clinical trial that sort of distinguished me. And that was the second 5 years of my career. And the third 5 years of my career, I was recruited over to Lenox Hospital, where I've taken a more leadership role and began to have my finger on the pulse of programmatic development as vice chair of neurosurgery at Lenox Hospital.
And now thinking about that, being the chair of neurosurgery there and working with also the residents and fellows that come through the system, what advice do you have for them as they go throughout the first job search process? And also, given the times we're in right now with COVID and not really being able to attend the national conferences, what do you tell them on how they can interact with colleagues or with people they're trying to get jobs with, even though they can't see them face to face?
The most important thing for a job is having a reference that is of high quality. So every resident must look within their program. If they don't have somebody in the program who can pick up the phone and make that call and vouch for them, that is the single most important thing. You can have the highest board scores, you can have the most publications, but you're not going to get hired unless someone picks up the phone and says, John, I got this girl who is just an terrific surgeon. She's a pleasure to be around. She's a team player. She published 10 papers for me. That's the kind of recruit we're going to take a hard look at. Just to send a resume or a CV across the desk of somebody, just not going to cut it, frankly. And yeah, the conferences are great. It's a great place to, meet and chat. But instead of a conference, just do a Zoom call. In fact, I sit on the search committee for a bunch of our chair positions. And I tell you, Zoom has changed the way we interview. We were sure wasting much less time going to meaningless dinners, and just do a Zoom call instead of going to a conference. But really make sure that person has a reference that can pick up the phone and vouch for them.
Now, can you elaborate on it? I think that's a very interesting point, and I do agree that Zoom has kind of changed the way we interact in the business setting. But if you're looking to bring somebody on, a junior or associate surgeon, how are you able to really vet them and do your due diligence on them from a personal standpoint if you're not meeting them and really only doing it over a Zoom chat?
Well, I think it's combined. I think Zoom can sift through the way we do it, and we're doing it now, is we have 3 rounds of interviews. The first 2 are in Zoom, and the third one is in person. So we're very satisfied. In fact, the data suggests that sometimes an in-person interview is not the best way to meet people. And to sit, for example, an applicant in a room around a mahogany table in front of 12 people, which is sort of historical way that some of these interviews occur, is not very productive, meaning that a one-on-one interaction, and even to take off some of that stress by doing it on Zoom, may actually be a better way to do it. But again, this is, we will go back to some of that traditional interviewing process, but I think Zoom is here to stay, and it's going to help us cut down on some of this time.
That in mind, what's the feedback you're getting from residents or fellows that you interact with as far as doing educational stuff over Zoom? Are they seeing it as a more effective and more efficient? Are they preferring the more in-person interaction? What's the kind of consensus behind that?
Well, look, I think it's mixed. There's surely now I'm part of a huge health system here in New York State, the largest health system in New York State called Northwell Health. I'm at Lenox Hill Hospital on the Upper East Side of Manhattan, but our medical school is on Long Island. Microsoft Teams and Zoom have been a godsend for us. So I can now attend things at the medical school or conferences, M&M, tumor boards, and never have to leave Lenox Hill Hospital. That's an advantage. I can teach the residents. I used to have to teach the residents every other Wednesday. Now I teach them every Wednesday. Every other Wednesday was in person. Now every Wednesday is on Microsoft Teams. So I think honestly, you want to have person-to-person interaction, but like our kids are having online education, you have an alternative now. You can educate remotely, and that's something we're surely taking advantage of.
That's great. I also think you've got some pretty interesting news to share regarding the Lenox Hill show on Netflix.
Well, we're really proud of season 1 of Lenox Hill on Netflix, and what I hope it shows to really the world, both the medical community and the non-medical communities, we expose the truths behind the walls of all the great hospitals in the United States and beyond. And there's no acting, there's no scripts, and we're just so happy of the critical acclaim that the production has seen. And although we can't officially guarantee season 2, that's ultimately up to Netflix to announce, they're extremely happy again with the response that we've seen to the first season of Lenox Hill on Netflix.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.